This is the BestHealth Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Hello, podcast audience. Welcome to the BestHealth Podcast. Standing in for Mr. Justin Gomez, I am Matt Britt, and I'm happy to be with you here today in Justin's absence. We've got a great guest with us, Dr. Merritt Adams with our Weight Management Center. Dr. Adams, nice to have you with us.
Thank you, Matt. Nice to be here.
We're very excited to talk to you today to learn a little bit more about what our Weight Management Center does and some intricacies of what our patients should expect if they choose to come and work with us to help them get healthier. But let's start off by talking a little bit more about you. Let's play it a little casual. So tell us about yourself and your background and what brought you to Wake Forest Baptist Health.
Yeah, so I will say I came to Wake Forest some time ago now. I originally came to Wake Forest actually for medical school, and then stayed here actually for the remainder of my medical training. So I've been here through med school, residency, fellowship, and then just loved it so much that joined the faculty with weight management after completing the fellowship. So I guess been here a long time.
That's awesome.
And chose to stay, yeah.
What drew you into the weight management side of things? I imagine at some point in your schooling you were looking at getting hints of every little specialty and so forth. What drew you to here? And
common question, right? Our field is certainly an up and coming one, fairly specialized. Not many people know about it.
Right.
I will say that before coming to medical school, my background was in nutrition. And I've got a little bit of a psychology background too. And so ultimately coming to medical school actually was more on kind of the GI side of things until I met our medical director, Dr. Ard, as part of my training program during residency, did a rotation with weight management, found that it would just be an excellent fit for me and my background and just my personality and kind of everything fell in place thereafter.
That's awesome. I can tell you, I mean, in all my interactions, I've interacted with a lot of the team. Yeah. Certainly a magnetic personality there in Dr. Ard, and I can see how he kind of pulled you in. That's an important piece of it.
He did. I will say, the stars aligned, so to speak, because the Weight Management Center has only been around now for 7-8 years at this point, and the fellowship was fairly new or in development when I was in training, and I was actually the first fellow candidate here at Wake Forest.
Okay. I didn't realize
that. Yep. So I started the fellowship, kind of blazed the trail, so to speak, and now we've got kind of fellows here after. So
yeah, we laughed earlier about Dr. Ard's charisma, and he certainly has it.
Yeah.
But I really do feel like, I don't know if it's a result of him or if it's just the kind of people he brings around him, but everyone I've met is just such a good person to interact with, and I think that's important for our patients to know too. I mean, the comfort level and that kind of personality and ability to engage, I think, is important in this process.
I agree, especially with what we do. I would say we definitely have just a very personal specialty when you think about all the various doctors and areas of medicine. I feel like weight is one of those places where you really delve into kind of someone's personal level and their thinking and their behaviors and there's a lot of subtlety that goes into that, and so it really takes a special team and a special person approach, all of that.
So you were talking a little bit about the team and kind of that social emotional intelligence approach that this team has, which I think is awesome, and certainly a piece of the Weight Management Center. But give me a little bit more about what the difference is at the Weight Management Center. What does our Weight Management Center do here at Wake Forest Baptist Health?
Sure. So that's kind of a loaded question, right? What do we do? We do lots of things.
Yeah.
So just kind of as a bird's eye view to our program, maybe for those folks that aren't familiar with the Weight Management Center. So we are both a comprehensive medical and surgical weight loss and weight maintenance program. I always like to throw that in there, right? Weight management is more than just losing weight. We focus quite a bit on the maintaining it thereafter too, which can speak about later, but just kind of touching on our approach. So like I mentioned, kind of a comprehensive approach to both medical and surgical weight loss and weight maintenance. So we've got a big team, like we've already alluded to, of providers. That includes medical providers, that includes dietitians, exercise physiologists, as well as behavioral providers, so psychologists and social workers as part of our team. And then on the surgical side of that, certainly surgical providers, in addition to all those other disciplines, the dietitians, the exercise physiologists, and the behaviorists, which really provides our patients that kind of full approach, again, that comprehensive approach to not only losing weight as a number on the scale, but all the other subtleties that play into how they got to the place that they're in today, right? You know, most people that come to us, this isn't their first attempt at weight loss,
of course,
right? This has been a long history for them, and we recognize that. And so I think it takes a little more comprehensive approach to work with these patients to say that, you know, we realize this isn't your first attempt. There are so many other things we need to tackle during this process. And so we do that.
You mentioned I think that's the most important part from an overview standpoint, is that multidisciplinary approach that we have. And the one to me that's most unexpected, obviously great professionals and great experts, but the one to me that's the most unexpected, perhaps to the general public, is the behavioralist, right? Like that you're coming at it from a psychological standpoint, which to your point, and I hate to admit I've been the victim of it myself, but that weight loss and then weight gain, right? Like you play that game, and it's all about the mental aspect. And I'm sure you agree that our society, our culture plays into that psychological. So what we're giving you at the Weight Management Center is a way to battle some of that.
Exactly. And I love that you bring up the behaviorists, because I definitely say that they're the underdog, so to speak. They're definitely the most understated of the group of us. But I think they're also one of the most important. Yeah. Right. People come into our clinic and they know that there's going to be a medical provider involved. They know that there's going to be a dietitian and exercise, right? Because you can't go through weight loss without touching on those. But it's the behavioral piece that gets them. I think patients are initially resistant to chatting with a behaviorist, but they ultimately realize going through the process that provider has so much to offer them. Yes. And almost plays, a bigger role in someone's weight loss and maintenance effort even than the other three disciplines.
With no offense to the other three,
not at all.
Incredible professionals, but just there is this. The mind is a terrible thing, they say, right? So
it is.
So that's the piece we're playing with and trying to make sure that we're staying on track with the goals and missions set forth by these other providers and other pieces of the team.
Yeah, absolutely.
Yeah. Okay. So obviously that's a piece of what's different from. When we talk about what's different from the kind of more commercially known programs, we're going to avoid saying them today so that we don't promote them. We're focused on Weight Management Center, but we know there are other options out there. There are. So what would be some of the biggest differences that people should be aware of, maybe besides the behavioralist, with our program versus some that they may find more readily accessible on their phone, an app or something like that?
Great question. I certainly wouldn't be doing my job if we didn't talk about those alternatives, because those programs definitely have their place, right? Patients have been successful through those various programs, but there are also reasons why they come to us thereafter. And so I will definitely say that the majority of our patients, as I've already mentioned, this isn't their first weight loss attempt. And oftentimes they come to us and they've already been through one of those various commercial programs. And so it's interesting to hear their experience, because I've never been through one of those programs myself, so I can't speak to it from the patient side. But one of the things that I think that we can offer, or maybe that we do a little bit better, if that's fair to say, is that comprehensive approach, and not just that we are tackling kind of the standard diet and exercise pieces, which I think we all know play into weight loss and weight maintenance. Definitely the medical piece, I think, is missing from a lot of those commercial programs, right? People come to our program not just to achieve their, what I call scale goals, right? The weight loss number on the scale, but also those non-scale goals. I think that's one thing that those other programs maybe don't look at. But when folks come to us, I want them to have more than just a number in their mind. I want them to come to me and say, Dr. Adams, I want to get off my diabetes meds. I don't want to take my blood pressure pills anymore. I want my knee to stop hurting.
Right.
And
Back.
I want my back to start. Sure. If it's the back,
Yep.
right? All of those things. And I don't think that's something that patients feel comfortable going to one of those other programs, and either because there isn't a medical provider there, or again, they're just focused on the scale. But anyway, that's certainly a big piece. And then on the flip side of that, one of the other things I hear commonly as a provider from folks who have been through those other programs is that they're pretty good at the weight loss piece. They're pretty good at helping folks lose the weight as a number on the scale. But then what happens? Right? They get the weight off and they get to maybe their goal number, and maybe they improve some of their health issues. But then there's no support. Right? Well, how do we keep off the 50 or 100 pounds that we lost?
Yes.
I find that far more challenging, actually, in what we do. The weight loss piece actually is the easier piece of the battle.
Right.
It's the keeping it off. And that's where I think we're most different and beneficial.
What's our typical lifespan of a relationship with our average patient? Where, to your point, and I can speak from experience. Let's see, I was on keto for. Oh God. I don't know that that's a brand. I think it's more of a thing, so I'm okay saying it. But I was on keto for like a month.
Sure.
And I've been on other apps and done other things for some period of time. What kind of my sense is that our relationship lifespan is typically longer because we're more ingrained in kind of your behavior there. Is that true?
Absolutely. And I would say broadly that our relationships are on the order of years.
Okay.
Not just because we're looking at the active weight loss piece, but then building that long-term plan to keep the weight off thereafter, whether you're in a formal weight loss and then weight maintenance program, or even if you just see us on an individual basis quarterly or every 6 months or whatever it is, like you would see your other subspecialists, right? We're just another piece of that puzzle in your healthcare, and so I definitely think we've got those relationships long term, and I encourage folks to think of us that way.
Yeah.
Most folks don't come to us and just say, I want to lose the 50 pounds, and then off I go.
And then out of here in a month.
Yeah.
That's not how it works.
And
I think that's a great thing.
Yeah, I think folks realize just that our approach is just that different. Right? It's more than just that little piece of weight loss.
I want to talk more about our program, but I feel like this is a good time. I broke news to you before we started our conversation today. So now we're gonna breaking news on our podcast. Breaking news. Some people may not have heard, but the USA Network is bringing Biggest Loser back to TV with Bob Harper hosting. And I love Bob. I mean, how can you not like Bob? Watching him on The Biggest Loser on NBC back in the day.
Guy, right?
So just for cultural reference and relevance, talk to us a little bit about how the things we were just talking about kind of align with what's happening there, and not necessarily about the show itself, but that kind of attitude aligns with what we were just discussing.
Yeah, absolutely. And you're right. I didn't know that it was coming back. I don't know all the subtleties of The Biggest Loser show. I've only watched it once or twice myself. Yeah. But my greatest concerns, I guess, about their approach to weight loss and weight management is just that it's an incredibly aggressive one.
True.
Right? They're I don't know, all the subtleties of what they're focused on, but my understanding is that it's a very rigid dietary process with a huge exercise component, which I think is what they're known for.
I read it the other day, I think 8 hours a day.
Oh my God. Okay, just for the future patients out there, I will never ask you to work out 8 hours a day. Please, Lord, don't do that.
Right.
But to your point, right, a very aggressive approach, and that's not where we're getting at.
Right.
Right. In order for folks to be successful with their weight long term, we've got to formulate a plan that is going to be sustainable.
Right.
And going about weight loss in the way that maybe The Biggest Loser does is maybe only effective for the short term.
Right.
But there's no way that someone can sustain that long term. And if they are successful with their weight loss, like let's say they lose 50 or 100 pounds or whatever, well, then what happens? Right? I've answered that question earlier. Then what happens?
And I think
once they stop.
Yeah, the research for Biggest Loser, if you go back to all the winners,
weight
I've read
just
some of
packs
this.
Right on
most
back.
of it comes back. Most of them add it back to some degree, if not fully. Maybe not always, way back to where they were, but that happens. And I think too the social, the TV aspect plays into it and kind of distracts from the position your mind's supposed to be in.
Right. Yeah. And without getting into the weeds, so to speak, of the science behind weight loss and weight regain thereafter, is that, when you lose weight in such a manner and then don't maintain those habits, your body, just as a protective mechanism, is going to put that weight right back on, right? If you go from working 8 hours a day back to 30 minutes 5 times a week, or whatever the case may be, of course the weight's going to come back. I mean, you can't expect it not to.
And I think I think it's a great point you're making about kind of the difference with us. And the one thing I would say about any program like that, and I think you'd agree, is wherever patients in our community and our population can find their inspiration, awesome. And I think what some shows like that can do is help inspire people to want to change. But the reason I wanted to bring it up was just to kind of level set that expectation as people start to see that in the news or paying attention to TV and seeing those kind of things. Know that there's a different process to do it the right way, and that's what we're doing here at Wake Forest Baptist Health in our weight management center. So I think those are great points. So I know we talked about a little bit about this earlier. We've kind of danced around it. Talk to us a little bit more about some of the different things that we encounter with patients' medical issues that we can help resolve. I mean, I really, when you were talking about that a little bit earlier, it astounds me when I think about it that there's so many things that get better, anxiety, stress, a long list of, all the pains you listed. There's certainly diabetes and more clinical, kind of serious clinical medical issues that can get better. But really losing weight and maintaining a healthy weight can affect you in so many different ways, right?
It can, and I absolutely love that you bring up the topic of those behavioral pieces, right? The stress, the anxiety, the depression, all those things that people tend not to want to talk about. Right. People tend not to want to come to clinic and say, I want to make my mood better because I'm 50 pounds from where I really would feel more comfortable being. Of course, I want patients to come to me, obviously as one of the medical providers at the clinic, and say, Dr. Adams, please help me with my diabetes, my high blood pressure, my high cholesterol, my joint pains, right? We have dedicated programs even to help folks lose weight so that they can get their joint replaced if that's what they need to, or just make that better. But I also want them to come to me with those other goals. Right? I want to help someone's mood if it's tied to the fact that they've been overweight for their entire adult life, or their social anxiety because they're overweight or whatever it is. And we haven't quite touched on some of the other smaller program options we offer, but I encourage folks who especially the ladies, maybe if they've been overweight their entire adult life, we've got options to help them lose weight, to maybe conceive or to have healthy children, all of that. Like, that's one thing that folks don't think much about. And again, one of those harder topics to maybe talk about,
Definitely.
but important things that I think we need to tackle in terms of weight.
Well, and I think from a system standpoint, from being part of Wake Forest Baptist Health, it's not going to be easy to talk to someone from a commercial competitor about some of those more intimate issues.
Right.
But we are an academic medical center. I love to say, when I talk about Best Health, a lot of the team has heard me say it, but we're an academic medical center, and we talk about teaching the doctors of tomorrow. I also think we're teaching the patients of tomorrow, right? So let's talk about how we can teach the community and the patients of tomorrow, and I think that's what plays in there, kind of what those kind of things that we're comfortable talking to you about that can help you be your best you, to live your best health, I think is an incredible opportunity coming to our system, as opposed to using using a potentially fine system that's not connected to the resources that we have here.
I agree 100%. Absolutely.
So let's as we get close to wrapping up here, I know part of what we do is medical weight loss, and that's your specialty, right? And
Well, I know better.
Understand there, but you're representing the entire Weight Management Center.
I am.
So let's talk a little bit for the public, about our listeners, about what kind of options we provide from a surgical standpoint, and kind of how we get to that point for our patients.
Yeah, of course. Like you said, I'm one of the medical docs, so that's my job is to help on the medical side. But we work incredibly cohesively with our surgical team too. We've got a great team of surgeons at all 3 of our clinic locations now, who can help folks achieve their surgical goals if that's the case too. And I want to explain that a little bit, because I think there might be a little bit of a question or misconception maybe about what the surgical side has to offer, and I will say we see a broad scope of patients on the surgical side that include the folks who are interested in surgery, right? Maybe they're folks who have never had bariatric surgery before. They've tried weight loss countless times in their life, and maybe they want to have a conversation with a surgeon about their various surgical options. Maybe they feel like that's the only option they have left. Fine, great. Our team of surgeons is happy to chat with you about that. On the flip side of that, we've got actually a good number of patients who come to us and they've had surgery before. Maybe they had surgery 5 or 10 years ago, somewhere else, who knows? And they lost some great weight then, they put the weight back on. Now what? Maybe they need a little help. So we can help on that side too, with what happens kind of after surgery, or maybe, who knows? Something like that.
So there's absolutely cases, that makes total sense. And so there's absolutely cases where some people have exhausted a lot of other options and come to us and are at the point where potentially they're ready to consider surgical. But there's also people that come to us going, oh, surgical, but we also have this medical weight loss option for you. Maybe you're at a position where you could consider that based on X, Y, and Z factors. Yeah,
and I encourage folks, maybe they're not sure what direction to go in. They come to us and they say, I know I'm at an unhealthful weight. I've tried a few times. I don't know what the right option is for me. Again, the nice part is we work very cohesively together, and so there are some patients who come and maybe they think initially that surgery is their only option, and they have a conversation with the surgeons, and the surgeon says, well, have you tried an intensive program, a comprehensive weight management program like our medical team offers? And they say, no, I don't know. I did X, Y, or Z commercial plan, and it was fine. And they say, well, give it a try for 6 months. Right. Just give it a go, right? And so they send them to the medical side, and we do what we do, and hey, successful. And vice versa. Yeah. Maybe I've got folks on the medical side who they've tried for years and years, and maybe they just can't maintain it for whatever reason, and maybe we send them to have a conversation with the surgeons for a more long-term option. Vice versa, That's just great. Depends on the patient. Yeah. And that's important for the team cohesiveness and the reason we have this weight management center. So let's talk about a couple pieces. One word we haven't mentioned, and we've alluded to it, is personalized.
right?
Yeah.
It really is. It's not a one size fits all.
Absolutely not.
I went to Dr. R's. We'll talk about this in a minute, but just to remind people about the seminars that we provide.
Yes.
We have online and in-person live seminars that you can find on our website. We'll give you that address here in a minute.
Yep.
But I've heard Dr. Art. I went to listen to one of his medical weight loss seminars. I need to come see one of yours one time. But I heard him speak specifically to the number of hours that we take in your first interaction with us. I think it's approximately 4 hours of time to build your program built around you, the individual.
In total, yeah, we've danced around this question, right? But I do want to give folks a sense of how we personalize our programs. So when patients come to us, whether they're interested in medical weight loss or surgical weight loss or what have you, at their very first meeting with us is certainly at an informational session, and we can talk about that. But we ask folks to come and just learn about our programs, learn about these this team of providers, because we certainly do come as a big team these days. And that's just step one. But you alluded to kind of a 4-hour long assessment. And in total, it probably is that long. Right. Our patients, when they come as new patients, so to speak, they have 2 visits, 2 kind of initial assessment visits, I'll call them. The first visit being about an hour to an hour and a half long, and that's kind of the data gathering visit, so to speak. And that's where we look at someone's medical troubles. We look at their lab work, if they've got, high cholesterol or diabetes or what have you. We look at their body composition, right? Their muscle, their fat mass, their bone health, all of that. And then we take an assessment of their metabolism. So we do a metabolism test and see where their metabolism is, right? Folks come to us all the time and they say, Doc, must be because my metabolism's broken. Right. So we check that too, right? We need that data. So anyway, that visit's about an hour long. And then when they come to new patient clinic, that visit is 2 hours minimum. Wow. I mean, it is a good chunk of time, and I encourage patients to set that time aside knowing that it's going to be 2 hours, because in that 2-hour new patient clinic visit, you get a true visit, at least 30 minutes apiece, with all 4 of the discipline providers, right, to get that best overall view of where you are today in terms of your weight history. And so that visit will include time with the behaviorist, yes, whether a psychologist or a social worker or whomever, to look at your stress, your mood, your goals, your weight history, all those subtleties that play into where you are. And then you get a visit with the medical provider of whoever's working that day, and they're going to look at, again, your weight history, your medical history, the medications you're on, that lab work, if there's abnormalities you didn't know about before. Examine your body composition and your metabolism test, and then, of course, do a physical exam of you. And then putting all of that together, you have a visit with the dietitian as the third part of your new patient clinic visit. And that's where you really get into developing a meal plan that fits you. Right. Again, this is not a one-size-fits-all, right? We all have different eating habits from day to day, different work schedules, different family lives.
That's so important.
All those things. And so the dietitian sits down with you and comes up with, what does a sample day in the life of you need to look like, right, for weight loss? And then lastly, they finish up with the exercise provider to take an assessment of how active you are at baseline. If you're inactive at baseline, where are the barriers? Is it a pain issue? Is it that you hate to be active? Right? I got so many people. Exercise just isn't their thing. Sure. And that's okay. The nice part is the exercise team is willing to meet you where you are, right? It may not look like you going out for a jog 3 times a week. That's fine. If you want exercise to be going to Zumba or a spin class or dancing in the living room with your kids, great. They'll kind of take that assessment and help develop that exercise plan for you.
That's awesome.
So lengthy visit, but really important pieces to the puzzle to get to know each and every person.
Yeah, and I appreciate the clarification. I didn't, certainly didn't mean 4 hours, but 4 hours in one sitting. But it is a process, and I want to push that point home of that personalized process that we develop in the formula that we come up for you, the individual sitting in front of us, to help you be healthier.
Yeah.
So the other point I want to hit on just real quickly for our listeners, you mentioned our different locations.
Yeah.
Tell us where all we have locations, because I think, sometimes I think within our growing system, as you know,
Yes.
it's surprising to people when they find out how far-reaching we are. So where can they visit us to visit the Weight Management Center?
Absolutely. So the Weight Management Center now proudly has 3 clinic locations. We initially began in the Winston-Salem office. They're off of Country Club Road. About 2-3 years ago, we opened our office in Greensboro. So that's up at our North Elm location. And then just May of last year, we opened our clinic in High Point. So they're near High Point, the hospital itself. Happy to help folks at any of the offices.
Well, that's awesome. I really appreciate your time today. Thank you for being with us. Enjoyed the conversation.
Absolutely.
That's awesome. And so for more information, people can go to wakehealth.edu/weight management. They can find your profile as well as all of your colleagues' profiles there on the website as well, and the location. So any information you have, you can find there. You can also call us at 336-716-6099. 336-716-6099. Thank you so much for being with us today, and we'll talk to you soon.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.